Module 2 Normal Labour. In this film of normal labour, we will learn about the following: process of normal labour, preparation to conduct delivery, precautions necessary to prevent complications during delivery, skills for conducting delivery. Kavita and her husband have come to the hospital for the delivery of their baby. It is necessary to ask the expectant mother certain questions immediately upon arrival.
How many children do you have?
One boy.
One boy.
Yes.
And you have also had one abortion. When was your last period?
10th December.
10 December. So this means your delivery date is 17 September. Okay, are you experiencing pains yet?
Mild pains.
Since when? Okay, is there any watery discharge too? Has there been any bleeding?
No.
Can you feel the movement of the baby? Is it turning?
Yes.
Have you had TT injections during this pregnancy?
Yes.
How many?
2.
2 shots. And have you had any problems during this pregnancy, such as high BP or anemia or diabetes? Okay, so no other problems? Good. Now I'll examine you. We will start with the abdomen. You need to bring me a urine sample in this bottle and please change into this gown. Show your tongue. Okay. I now need to do an internal checkup. We will see how much the cervix has dilated and how low the baby's head has descended. During the exam, please take deep breaths. You will face a little discomfort, but there will be no pain. I will wash my hands and start the examination. I will now tell you about the PV or internal checkup. The first step is to check the dilatation of the mouth of the uterus, the cervix. Generally, the dilatation ranges from 0 to 10 centimeters from the point of the start of labor pains to the delivery of the baby. One finger is usually 1 to 1.5 centimeters wide. One finger goes in, that means 1 centimeter dilatation. 2 fingers mean 2 centimeters. This is 3 centimeters, 4 centimeters, 5 centimeters, 6, 7, 8, and finally it opens to 10 centimeters width. At this stage, you cannot even feel the rim of the cervix. If the size of pelvis is adequate, with the cervical dilatation and labor pains, then the head of the baby gradually descends on its own. So when we do the PV, along with cervical dilatation, we should also check for pelvis adequacy. I will now demonstrate how to check for adequacy of pelvis. First, we try to reach the sacral promontory, which we are usually not able to reach in a normal pelvis. After this, we check the hollow of sacrum, which is well curved in a normal pelvis. After this, we examine the ischial spines, which are not prominent in a normal pelvis. And we will not be able to touch both ischial spines at the same time.
When the cervix is dilated 4 centimeters and the mother is having at least 3 contractions in 10 minutes, each one lasting 30 to 40 seconds, she is in active labor. It is now time to use the partograph. It's a simple, very important tool used to monitor the progress of labor. The partograph records the following details: fetal heart rate, cervical dilatation, uterine contractions, maternal pulse, maternal blood pressure, and temperature. Every half hour, the fetal heart rate, uterine contractions, and maternal pulse are to be recorded. Every 4 hours, cervical dilatation, maternal blood pressure, and maternal temperature are recorded. Encourage the expectant mother to walk around and drink liquids during the first stage of labor. Maintain a friendly attitude towards her.
I will explain the important supplies needed for a good delivery room. First is the delivery tray, which should contain 2 artery clamps, 1 scissor to cut the umbilical cord, 1 kidney tray in which the placenta will be kept for examination, and 2 perineal pads, one for support and the other to use later. Other than this, you must keep a pair of surgical gloves, a mask, a cap, a fetoscope to check the baby's heartbeat, and also a BP apparatus to check the vital signs of the mother. Now we can look at the second trolley. First of all, you need the tablet metronidazole, capsule ampicillin, injection gentamicin, injection magnesium sulfate, injection oxytocin, tablet misoprostol, spirit swabs, ringer lactate, leucoplast, IV set, syringe with needle, and finally the partograph. Other than this, you need dipsticks, puncture-proof box, and a needle destroyer. Now I will show you the things needed for the newborn corner. First up, a weighing scale, 2 pre-warmed towels, a pair of gloves, sterile blade and cord tie, torch, injection, vitamin K and syringe, ambu bag and mask, and finally, suction catheters.
Let us discuss whatever we have seen in the film till now. Your trainer will help you in this. What is the definition of active phase of labor? What's a partograph and what parameters are monitored with it? What materials or trays are needed in a labor room? Name a few old practices which are not evidence-based. What is the parity and LMP of the pregnant woman in the video? Let's discuss. There are some important things to remember during delivery. The perineum area should not be shaved. No routine enemas should be administered. Allow the mother to change her position if she wants to. Do not apply pressure on the abdomen to push out the baby.
Now we will see how a child is delivered from a bony pelvis. The occiput area of the skull rests over here on the bone. Then, gradually, it moves forward in 1/8 circles. When it reaches behind the symphysis pubis, it slowly slides downwards. And when this much of the skull is outside, the rest of it comes out very fast. To prevent the head coming out suddenly, we apply flexion. We first support it with a perineal pad in one hand and use the other to apply flexion. I will demonstrate. To deliver the head properly, it is very important to provide support with a perineal pad in one hand and use the other hand to apply flexion. After the head has come out like this and the rotation is complete, then you can bring out the interior shoulder by pressing it down and then the posterior shoulder by pressing it up. And finally, the body can be brought out laterally. The baby should be placed on mother's abdomen, okay, and then dried completely.
When the cervix is fully dilated, shift the woman to the delivery table. The baby is now about to be delivered. Keep one hand gently on the head to flex it as it comes out with the contractions. Support the perineum with the other hand during delivery and cover the anus with a pad. When the baby's whole body is out, place it on the mother's abdomen. Clean the child with a dry, clean towel and wrap it in another clean towel. Keep the abdomen flexible and palpate the abdomen to rule out the presence of another baby.
If there is no second baby and the pulsation is over, clamp the umbilical cord into two places. One at 2 centimeters away from the umbilicus and other at 5 centimeters away from the umbilicus. Then, cut the cord in between these two clamps.
Cutting the cord after 2 to 3 minutes of delivery increases the amount of blood transfused through fetal circulation, helping prevent neonatal anemia. We are now ready to begin active management of the third stage of labor, which saves many lives.
Palpate the abdomen to ensure that there is no second baby. When you are certain of this, administer 10 international units of injection oxytocin, which is 2 ml intramuscular. Alternatively, 3 tablets of misoprostol 200 microgram amount to 600 microgram can be given orally to the mother. After this, you can deliver the placenta. Hold the cord wrapped on the forceps with one hand and apply counter traction with the other. Now, try to pull the placenta out, applying slight traction all the time. If it does not come out to 30 to 40 seconds, then let go and wait for the next contraction. Along with the next contraction, remove the placenta while applying slight tension to the cord.
As the placenta delivers, hold it with both hands. Gently twist the placenta and membranes and remove them without damaging the uterus. Immediately after the placenta and membranes are delivered, massage the woman's uterus through the abdomen to ensure that it's well contracted, while ensuring that there is no excessive bleeding from the vagina. After you stop the gentle massage, it is important to make sure that the uterus does not relax again. If the placenta does not deliver within 30 minutes or the woman starts bleeding profusely, start an IV drip with 20 units oxytocin at 30 drops per minute and refer to a medical officer. Always check the placenta for completeness. Hold the placenta in the palms of the hands with the maternal side facing upward and make sure that all lobules are present and fit together. Then hold the cord with one hand, allowing the placenta and membranes to hang down. Place the other hand inside the membranes, spreading the fingers out to make sure that the membranes are complete. Ensure that the position of cord attachment to the placenta is normal and inspect the cut end of the cord for the presence of 2 arteries and 1 vein. Immediately after delivery of the placenta, the uterus must be massaged. Repeat this every 15 minutes for the first 2 hours and ensure that the uterus does not become soft. Examine the perineum, vagina and vulva for tears. First-degree tears can be managed by applying pressure till the bleeding stops. Second-degree and more severe tears need stitches. After applying pressure to control bleeding and packing the tear with sterile gauze, refer for treatment. Remember that after each delivery, you must check the following 3 times in the first 30 minutes and then 2 times in the next 30 minutes. General condition, BP and pulse, vaginal bleeding, contraction of uterus. Remember to use gloves while handling the placenta. Put the placenta into a leak-proof bag containing bleach. Bury it at least 10 meters away from a water source in a 2-meter deep pit. Counsel the mother to breastfeed, including colostrum, as soon as possible. This should begin within 1 hour of birth. Advise her to keep the baby warm, eat well, take adequate rest, and maintain hygiene.
I will now tell you about some danger signs to watch out for. If you notice any of these, come to the hospital immediately. For example, if you have excessive bleeding from your vagina, if you have severe headache or visual disturbance or gastric pain, or if you have fits, you have to take very seriously. If you have a lot of pain in the perineum area, or if obstruction of urine or stools or inability to control these, anything like this happens, you must come to the hospital immediately.
Let us discuss whatever we have seen in the film till now. Your trainer will help you in this. List steps in active management of 3rd stage of labor, AMTSL. When should the woman come back for a checkup post-delivery? Let's discuss. Let us repeat the main messages of the film. Plotting a partograph helps in monitoring progress of labor and timely identification of complications. Essential supplies and equipment must be available and functional in the labor room. Practices that are non-evidence-based and unnecessary be best avoided. AMTSL must be done in every